Hi, and welcome back to the Made to Mom podcast. I'm your host, Dr. Alexia Priello, naturopathic doctor. On today's episode, I'm going to be discussing a topic that is incredibly important, but it might be triggering for some. It's about early pregnancy loss. So, if you're not up to listening to today's episode, I totally get it. Pregnancy loss is an awful and traumatic thing to experience. Like, no one should ever have to go through it multiple times, let alone once. And the grief that someone experiences after a loss is similar to a grief after losing a loved one. And while many people blame themselves for the loss, most cases are due to chromosomal abnormalities of the embryo. But people who experience loss are at an increased risk for depression, anxiety, obsessive compulsive disorder, and PTSD. And these feelings can persist long after the loss has occurred. Now, before I dive into the sensitive topic, I do want to highlight that the show notes will link resources like Sunnybrook's Pregnancy and Infant Loss Network, but also early pregnancy assessment clinics in Toronto. This is where I am currently located. Most Toronto hospitals have early pregnancy assessment clinics, which can be accessed by referral through your family doctor or practitioner from that particular hospital's emergency department. Some hospitals will see pregnant people up to their 13 weeks of pregnancy and some up to 20 weeks of pregnancy. So, with that said, let's discuss early pregnancy loss, which is a loss or miscarriage that occurs up until the 13th week of pregnancy. Miscarriage occurs in about 1 in 5 of pregnancies, with nearly 80% of miscarriages occurring in the first trimester. About half of all early pregnancy losses are due to chromosomal abnormalities in the developing embryo. Signs and symptoms of early pregnancy loss include bleeding with or without tissue. Bleeding occurs in about 25% of pregnancies and isn't always associated with a loss. For example, subchorionic hematomas also present with bleeding, and people can go on and have a live birth after experiencing those. Abdominal or pelvic pain is common in about 85% of pregnancies, and it can also be experienced within the first 7 weeks of pregnancies. And cramping is another symptom that's commonly experienced. The risk of pregnancy loss is 5 times greater when pregnant people experience both bleeding and cramping compared to just cramping alone. Now, there's an emergent condition called an ectopic pregnancy where people need to seek care right away. Symptoms of an ectopic pregnancy include worsening abdominal pain, dizziness, bleeding, shoulder tip pain. So you might be wondering, like, are there any factors that increase the risk of pregnancy loss? And yes, they include maternal age, older than 35 years old, history of early pregnancy loss, infections like chlamydia, an older paternal age, BMI extreme, so someone who may be underweight, all the way to someone who is considered obese, smoking, alcohol consumption, physical trauma, physiological stress, and an exposure to toxins like air pollution and pesticides. Now, depending on your symptoms, physical exam, and ultrasound findings, there are a few ways that a miscarriage can initially present. And they include a threatened miscarriage, which you might experience bleeding or cramping. On the physical exam, the cervix will be closed with no tissue in the vaginal canal. And on ultrasound, this might show cardiac activity of the fetus, which would indicate a viable pregnancy. You might have an incomplete miscarriage where you're noting symptoms of bleeding or cramping. The cervix on physical exam can either be open or closed with tissue or blood clots found in the vaginal canal. And on the ultrasound, there would not be any cardiac activity. An inevitable miscarriage again includes symptoms of bleeding and cramping. On physical exam, the cervix is open with tissue or blood clots present in the vaginal canal. And on ultrasound, this may show cardiac activity of the fetus, which indicates a viable pregnancy. A complete miscarriage, you will notice symptoms of bleeding or cramping. The physical exam will show that the cervix is closed and all tissue has passed, and it's usually followed by continuous bleeding or spotting. And on ultrasound, there's no cardiac activity. And then on a missed miscarriage, you might not experience any symptoms. So, no bleeding, no cramping. On physical exam, the cervix will be closed with no tissue in the vaginal canal. And on ultrasound, there will be no cardiac activity of the fetus. Now, usually a missed miscarriage is seen at a routine screening in the first trimester. So, this might be in that dating ultrasound, which occurs within 6 to 8 weeks, or it might be seen at someone's nuchal translucency ultrasound, and that occurs between 11 to 14 weeks. During these scans, the pregnant person might be told that no cardiac activity is seen and the fetus hasn't grown. Um, so when it comes to testing, and like when there's an early pregnancy loss is suspected, like a lot of pregnancy or a lot of testing is done. So this can include a complete blood count, blood typing, Rh factor, and beta hcg levels. So if you've listened to a number of the episodes so far this season, I've spoken about beta hcg. You know that it's commonly known as the pregnancy hormone, and it quickly increases during pregnancy. It can be detected via blood 11 days after conception or by urine 12 to 14 days after conception. Now, a single beta HCG test cannot diagnose if a pregnancy is viable or where the pregnancy is. So, a baseline is needed to determine if beta HCG is like increasing or decreasing. Levels typically plateau in a normal developing pregnancy around 8 to 10 weeks, and then it can drop. And so, this is why an ultrasound is needed for diagnosis. Now, this is a transvaginal ultrasound or an endovaginal scan, and this is able to assess for fetal viability and the location of the pregnancy. An early pregnancy loss is diagnostic when there is no visible embryo seen. So they're looking for something called the fetal pole, which is the first sign of a developing embryo. Um, and then they're also looking for a gestational sac diameter that is 25 millimeters or greater. Um, the second diagnostic criteria of an early pregnancy loss is that the embryo does not have any cardiac activity and has a crown rump length of 7 millimeters or greater. Now, if the criteria for early pregnancy loss is not met and an intrauterine pregnancy is likely, then a repeat scan might be done to determine how the pregnancy will proceed. If there is a clinically complete ultrasound, an additional one isn't required. But if bleeding and cramping persists, then another ultrasound may be done. If a pregnant person is bleeding and they've had a previous ultrasound confirming pregnancy, then a follow up ultrasound is warranted if vaginal bleeding worsens or persists beyond 14 days. Now, there are a couple ways that um, an early pregnancy loss can be managed. And from a naturopathic perspective, like there's not a ton that we can do beyond just like counsel visits or educate clients like what to expect. So, the first management strategy is an expectant management, which is essentially like the watch and wait approach. So, it's considered safe for people experiencing early pregnancy loss who are stable, who don't have any active pelvic infections, no severe anemia or bleeding disorders, and no active uterine hemorrhage. Within 1 week of the miscarriage, about half of people with an early pregnancy loss will spontaneously pass all pregnancy tissue. And this is especially common if they're already experiencing bleeding and cramping. Obviously, though, like if this doesn't happen, then another management pathway may begin. If the loss is certain, routine care may look like performing an at home pregnancy test, doing another serum, HCG, a follow up ultrasound, or review any of like the lingering symptoms someone might be experiencing. Medical management is using pharmaceuticals to bring about a complete miscarriage earlier than expectant management. Now, not everyone can use these medications though, so it's best to speak to your care provider just to ensure that this is an appropriate treatment method for you. So, The pharmaceuticals will go ahead and induce uterine contractions and block progesterone. Heavy bleeding and cramping can also be expected with these medications and may occur a few hours after starting them. A person might also see fetal tissue if the loss is over 9 weeks during this process, which understandably can be very difficult. And light bleeding might continue for another 9 to 16 days. In the instance of excessive bleeding, filling more than 2 pads per hour for 2 hours, fainting or passing out, or experiencing severe abdominal pain, a person should return to the emergency department right away. If a person is also noticing prolonged bleeding or cramping more than 8 weeks without a period, or a bulky uterus with an open cervix, so this can be seen via physical exam, then a follow-up ultrasound may be performed just to assess for an incomplete pregnancy loss. In terms of surgical management, this is the management strategy which requires the fewest visits with a healthcare provider, but it may involve the aspiration of certain products of conception or a procedure called dilation and curettage, which is known as DNC. Antibiotics may also be prescribed as part of this management strategy. Now, this type of management is recommended in those experiencing heavy bleeding, like soaking through 2 or more pads in 2 hours, signs of infection, anemia, or bleeding disorders. And it's also recommended for molar pregnancies and when there is an intrauterine device that can't be removed. Now, in terms of future pregnancy, I just wanted to say that, early pregnancy loss can have serious emotional and physiological effects on a person. It can bring feelings such as grief, guilt, depression, and anxiety. And it's a traumatic experience no matter how many weeks a person is. And, a possible reoccurrence might be at the forefront of someone's mind, as they experience subsequent pregnancies. When someone is emotionally and physically ready to conceive again, they can start trying after their first period following their miscarriage. For newly pregnant people with a history of loss, an ultrasound is recommended at 7 weeks gestation to assess for the location and viability of the pregnancy. And while this appointment might cause some apprehension, it's meant to provide reinsurance, address modifiable risk factors of early pregnancy loss, for instance, like uncontrolled diabetes, malnutrition, smoking, mental health, and review what to do in case bleeding occurs. Okay, this was a heavy one, but I think it's incredibly important to be discussed because it is common, in pregnancy. And also, we got guidelines. The perinatal community got guidelines this year from the SOGC about early pregnancy loss. And so I wanted to highlight that this season. Thank you so much for listening to this episode about early pregnancy loss. While it is a tough topic to discuss, I hope you found it informative. Please check out the show notes for more information. And if you found this episode helpful, please consider subscribing to this podcast, leave a review, or follow me on social media. I'll talk to you next time. Take care.